Hey everyone, in this video I'm going to be describing the differences between panic attacks and panic disorder. So let's get straight into it. When it comes to both these conditions, females are twice as likely to be affected than males. It affects 2 to 3% of adults in the US in a year, and then rates often increase in adolescence and then will peak in early adulthood. The highest comorbidity with these conditions is major depressive disorder. So let's start off by talking about panic attacks. And panic attacks are sudden episodes of intense fear or discomfort. Generally, the attack reaches its peak within a few minutes, and they can be triggered by certain events or they can just occur unexpectedly at random moments. And in order to diagnose panic attacks, you need to have 4 or more of the following symptoms. And there's a lot of them, but generally they make a lot of sense, and I'll make my way through them quickly. So palpitations, sweating, trembling or shaking, shortness of breath, feeling of choking, chest pain or discomfort, nausea, dizziness or lightheadedness, feeling of like chills or heat, paresthesias, derealization or depersonalization, fear of losing control or going crazy, and a fear of dying. Now, when it comes to panic disorder, this is recurrent, unexpected panic attacks. So panic disorder is a pattern of panic attacks. These attacks are followed by 1 or more month of at least one of the following. So you need to have an attack, and then after that you need to have a month or more of the following. This is persistent fear of having another panic attack, or you need to have changes in your behavior related to the attacks. So what happens is a person is so afraid to have these attacks that they change their behavior in order to kind of avoid any triggers they fear could cause an attack. When it comes to treatment of these conditions, the acute treatment in the moment if someone is really experiencing distress is to offer benzodiazepines. But generally, over a long term, what you want to do is incorporate both cognitive behavioral therapy and medication. So generally, the first line for these conditions are SSRIs or SNRIs. So let's try a couple questions to test our understanding. So what is a common symptom experienced during a panic attack? The options are dizziness, muscle relaxation, slow heart rate, and steady breathing. Pause if you need a second. The answer here is dizziness. And then remember, to diagnose panic attacks, you need to have 4 or more of the symptoms that we discussed. Here's another question. It asks, which of the following is true? First line treatment for an acute attack is bupropion. Panic attacks reach peak within a few minutes. Panic attacks are more common in males. Chronic treatment for panic disorder is benzodiazepines. Pause if you need a second. The correct answer here, of course, is that panic attacks reach their peak within a few minutes. Remember, the first line treatment for an acute attack is a benzodiazepine, and that panic attacks are more common in females, and that the chronic treatment for these conditions are therapy and medication. I hope this video was helpful in explaining panic attacks and panic disorder. If you have any questions, please feel free to leave them below. Thank you.